Jones. I'm Amanda. I'm going to be your nurse today. How you feeling?
Fine.
Okay, good. Well, I'm going to just do some identification here and make sure you are who you are. If you could give me your first and last name
Name.
and date of birth.
Date of birth.
Lovely. All right, so we did medicate you for some pain about 30 minutes ago, and you said that your pain at that time was an 8. How are you feeling right now?
Oh, about a 3.
3, so on a scale of 0 to 10, 0 being nothing, 10 being the worst, pain's about a 3?
Yep.
Okay. Beautiful. All right then. Well, we're gonna get started on some wound care here. I'm gonna move your bell over here. All right, and then I'm gonna do some hand hygiene, and I'm gonna expose your wound. All right. And okay. Get some clean gloves on here. Alrighty, so I'm gonna go ahead and take this off here. If the tape will come up. There we go. Alright, and I'm going to assess. The abdominal pad is about 25% saturated with serosanguinous fluid. And we're gonna put that in the garbage. Then I'm going to remove the packing here, which is about 50% with serosanguinous fluid, and throw that in the garbage. All right, so I'm going to take a peek at your wound here, Mrs. Jones. It looks like the edges are well approximated. I do see nice red granulation tissue on the inside. No signs of infection. I don't smell any foul odor, so it's looking good. All right, so I am now going to unpackage my wound care kit. Oh, I'm gonna first let me clean off my. Do some hand hygiene here. All right, good enough. All right, keeping in mind the 1-inch border. Okay, and I don't need this, so we're gonna go ahead and put that off to the side. And I have my sterile gloves. I have my sterile water inside of the kit, so we're gonna go ahead and use sterile gloves to open that up. And putting on my sterile gloves. Okay. And because my sterile water is inside the kit, it is safe for me to touch it. And my abdominal pad, blue side up. Not touching the 1-inch border.
Yeah, the only thing you have to watch out for is
and CNA Melissa, it would appear that I have no gauze in this. So if you would be so kind as to bring me some gauze.
and then, like if you don't do that and you do this stuff, someone's like unhappy because they just can't do it. But anyway, that's why I ended up not going into it because I'm just not passionate about plastics. What was it? Basically, like if someone sees you,
Thank you. All right, so we're gonna go ahead and just leave the gauze here because I do need to measure first. Measure at 10 centimeters long.
definitely helpful to like work under the umbrella.
By 2 centimeters wide.
Yeah.
By 2 centimeters deep. And we're gonna put that in the garbage. Okay, so I have my sterile gauze.
Next week. Yeah. They'll be like, oh, you're nurse, you have a license? Sure, you have a job. Yeah. I would do whatever you kind of had in mind.
And we're going to moisten that with the saline.
It's very, like, once you got that license, you're good to go. So,
Squeeze out the excess.
yeah.
Okay. So we're going to go ahead and we're going to pack the wound, not touching the edges. Okay. Garbage. And then I'm going to take these 2 4x4s and we're going to cover that along with the abdominal pad. Place it over the wound, blue stripe up. Okay. All right. Okay, so how are you feeling, Mrs. Jones? You doing okay?
I'm doing fine.
Okay, so any severe pain or discomfort while I was doing that?
No.
No? All right, sweetie. All right, so I'm gonna go ahead and dispose of these gloves now. Okay, and some hand hygiene. Okay. All right, so I'm gonna get you covered back up. Get you back. Okay, you doing okay? You're comfortable?
Yeah.
All right, so I'm gonna get your call bell. I'm gonna put it right here for you. Is there anything else I can get for you, Mrs. Jones?
Maybe some water.
Maybe some water? Okay, well, I will check with your doctor to make sure that we can do that. Last time I checked, we still had you on NPO.
Oh, fine.
All right, okay. So you enjoy the rest of your evening, and I'm gonna go ahead and clean all this up, okay?
Okay.
All right.